The following videos are a demonstration of the basic skills required to care for a child with a tracheostomy. Now, this is not meant to replace hands-on training, but to provide an additional resource. Personal protective equipment, or PPE. Gloves, sterile gloves and eye protection, mask, or gown as indicated. Appropriate sized, disposable sterile suction catheter, clearly marked with numbers. Individually packaged suction device for oral and nasal suctioning if indicated. Self-inflating bag connected to an oxygen flow meter. Normal saline in disposable vial or sterile water. Pulse oximeter. Suction source, so you'll need a wall regulator or portable machine and have connector tubing and a collection container. Stethoscope and a trach-to-go bag at the bedside. Perform hand hygiene before patient contact. Ensure that the appropriate supplies for the procedure and emergency resuscitation equipment are fully functioning and available at the bedside. Verify that the suction unit is turned on and that the pressure is within the recommended range. Set the suction pressure between 80 and 100 millimeters of mercury for infants and between 100 to 120 millimeters of mercury for children. Check the unit's negative pressure by occluding the end of the suction tubing before attaching the suction catheter. Select the appropriate type and size of suction catheter. Use a suction catheter with measurement markings. Using the trach size, multiply by 2 and then round down to an even number to determine the size of the suction catheter. For example, if you have a trach size of 4.5, multiply it times 2, that equals 9. You round down to 8, so you'll know that you'll use a 8 French suction catheter. Verify the pre-measured length for the suction catheter insertion before inserting the catheter into the airway. If the pre-measured depth is unknown, obtain the depth by measuring the length of an extra tracheostomy tube of the same size. Record the appropriate length of the catheter insertion measurement in the child's record and display the length at the bedside if it is not already displayed. Perform hand hygiene and don gloves. Open the sterile suction catheter package on a clean work surface. Maintain sterility on the inside of the package. If indicated, set up a flush solution to flush the catheter and clear thick secretions of the tubing as necessary between suctioning events. Fill the container with enough sterile water or saline to flush the catheter as needed. Coil or wrap the suction catheter around the dominant hand. Using the non-dominant hand, pick up the suction connection tubing and connect it to the suction catheter. If indicated, pre-oxygenate the child using the ventilator or self-inflating bag with 100% oxygen for between 30 and 60 seconds. Disconnect the child from the ventilator circuit with the non-dominant hand or instruct an assistant to disconnect the child if clinically indicated. Insert the suction catheter into the tracheostomy tube to the pre-measured length. When the pre-measured depth is reached, withdraw the suction catheter using a twisting or twirling motion, while at the same time applying continuous or intermittent suction. Limit the total suction time of each suctioning event to less than 10 seconds. Coil the suction catheter around the dominant hand and return the child to the ventilator circuit with the non-dominant hand. Hyperoxygenate the child after the suctioning event for 30 seconds. Assess the need for more suctioning and repeat steps for passing the suction catheter. Flush the catheter with sterile water or saline solution if indicated to maintain patency. Allow the child sufficient recovery time between passes of the suction catheter. Evaluate and assess the tracheostomy tube patency if tracheal secretions do not clear or indicators for suctioning do not improve after repeated passes of the suction catheter. With the catheter wrapped around the dominant hand, pull the glove off around the catheter inside out. Remove the other glove and discard it in a waste container. Flush the connecting tubing with sterile water or saline solution. Secure the suction device at the bedside in clear view for future suctioning needs. Assess the child's cardiopulmonary status and breath sounds to detect any pertinent changes after suctioning. Discard supplies, remove personal protective equipment, and perform hand hygiene. These videos are available for you to review as often as you would like. If you have any questions about any of the skills shown here, please ask a member of your healthcare team.